To be nominated for this award is, I think it's a very prestigious thing. I'm flattered and I'm surprised. But I also think that it is a more than me personally, it is a reflection of what our consortium has done and come in a long way in making a lot of achievements over the last 15 months. And it's also, I think, a reflection of the work that I have done and what we have done in NHS Wirral for the last decade or more. I think one of the reasons my nomination stood out was because apart from providing vision and leadership, I was able to inspire new people to come on board and to take leadership roles and develop a team, and I think that could be one of the key factors. I have been a leader for last 26 years as a GP, developing a practice from single-handedly to now managing 10,000 patients and a team of nearly 10 doctors and 40 staff. And as a leader, I have been involved in various roles. And for the last 14 years, I have been as a medical director in NHS Wirral. I've been a PEC chair. I have led a range of modernization groups, improved services, involved in service redesign. And over the last 5-6 years, we have developed the PBC group, which has now gone on to become the consortium. So I have been consistently working to improve services. To summarize, what I've been doing is to bring general practitioners, patients, and other stakeholders in the healthcare together so that we can look at how we can improve the services, look at every single service and how we can change it and improve the pathways and also make it much more patient-centered. I think to win the award would be on a personal level a vindication of all that has been done, and but it's also much more important that it's a reflection that I'm the leader of a team and it is the work that has been done by a number of people within the team, and I would see this as a recognition of that.
I'm absolutely delighted to have been nominated for this award. I think the North West is very fortunate to have a number of great leaders within it, so I feel particularly privileged to have been nominated for this award. I think the reasons that I was nominated were around my absolute passion for improving services for women at Liverpool Women's Hospital and actually having a very value and behaviour-based approach to our leadership within the organisation. I think I hope what has come through is my absolute passion for ensuring that within Liverpool we have the best possible services for women to actually access, and also that we have a great organisation for staff to work within. I've been in the NHS for 28 years and I started my career at quite a junior level within human resource management, worked in a number of organisations across Cheshire and Merseyside and Manchester, and moved on to operational management, organisational development before becoming the Chief Executive at Liverpool Women's Hospital. I put my success as a leader down to two main factors really. One, I've been incredibly fortunate to work with some really talented individuals and teams throughout my career, and also the fact that I have a very supportive family, 2 children and a husband who support me greatly to allow me to achieve what I've achieved. I'd be absolutely delighted to win this award, not just for myself, but also for all of the staff at Liverpool Women's. I think it'll be a testament to what we've actually achieved at Liverpool Women's over the years. I think that the drive would be, being a woman and being the chief executive of a women's hospital, you know what it feels like when patients access the various services that we have on offer. So you can relate each and every day to the experiences that patients are going through. We all get touched when our families, a member of our family has a baby or is experiencing fertility problems, or indeed has a major cancer, all of which we deal with at Liverpool Women's. So I think the services that we run lend themselves to people being very, very passionate about them. I think some of the successes over the last couple of years have been about the challenging financial environment that we all find ourselves in, and I think particularly the approach we've taken at Liverpool Women's is to be very, very inclusive around how we drive efficiencies through the organisation, and that at the absolute heart of that is improving quality of care to patients and improving the experiences for our staff.
I'm delighted to have been nominated for an award. I've been nominated by my colleagues and my chair at the Trust, and I've been at the Trust for 14 months and I've worked to develop a new strategy and a new building plan so that we can enhance the patient experience, and I feel that by nominating me for this award my colleagues have recognised the good work that I've tried to do over the last year. When I came to the Walton Centre, which is 14 months ago, I realised quite quickly that we weren't able to fit all the patients into the hospital that needed to be seen and treated. So I worked with staff right across the organisation to develop a 5-year strategy looking at how we could enhance the experience of patients. And I also worked very closely with consultants, nurses, doctors, therapists to look at how we could build a new facility for patients on the site. We've now got planning permission for that. We've managed to move it forward and we've started the build. So I think that colleagues have nominated me because of recognising the issue and working with them and bringing everybody on board to develop a new facility for our patients. I hope my nomination stood out to the judges because the 5-year strategy that I've worked on and the building plans are all focused on giving a better patient experience. I've also focused in the strategy with staff on how we enhance research and development, because as a centre of excellence at the Walton Centre, to keep ahead of the game for patients, we need to make sure that we've got excellent research facilities and trials facilities so that we give the best treatment that we can. And I've really focused on that, and I've been very fortunate with my chief execs and medical directors across the region voted me to be chair of a CLRN, so I've also been able to work on research and development across the region as well as in the Walton Centre. I came into the NHS because my brother had been ill for 10 years. He had a terminal illness, and during that 10-year period he received some really poor care in NHS settings, and I wanted to come into the NHS to make a difference to the lives of patients. So I had very clear values when I came into the NHS. It was about having excellent compassionate care for patients, getting things right first time, and also doing all that within value for money because we are a tax-funded service. So I've kept true to those values, and as a leader I've worked in a lot of different organisations. I've worked in Care Trust, Ambulance Trust, Mental Health Trust, an Acute Trust, and now a Specialist Trust, where I've tried to be true to those values and work with the values of the organisation. And I feel now at the Walton Centre, the values of the Walton Centre are caring, respect, openness, dignity and pride, and that really complements my values, so it's a really good place for me to be a leader in the NHS. My focus is on patient care, so I try and focus everything on getting the best result for the patient. I'm also very energetic and very resilient. I get out of bed in the morning glad that I'm coming to work, and I think that gives me that energy to work with people to make sure the patients get a really good deal from the organisation I'm working in. Well, I'd be absolutely delighted to win this award. At the Walton Centre, we've worked really hard over the last 14 months and across the region to make sure that patients get a good journey through our hospital. And it means that my colleagues who have nominated me have recognised that and the hard work that we've all put in. So I'd be absolutely delighted. It would be the icing on the cake for me, and a job that I love, to have that recognition from my colleagues.